Hello, and welcome to today's workshop. This workshop will be focused on the basics of blood pressure. It is one of many workshops available through our Rancho I Choose Health or RICH program offered through the Don Canabe Wellness Center at Rancho Los Amigos. If you have a blood pressure machine at home, it will be helpful to have it nearby during this workshop. We will be practicing taking your blood pressure. As I mentioned earlier, this workshop is dedicated to blood pressure basics. Please take a moment and think about what you'd like to accomplish in today's session. By the end of today's session, it is my hope that you will have an understanding of the following topics. What is blood pressure? How to measure your own blood pressure at home using a blood pressure machine? What are normal and abnormal ranges for blood pressure? What ranges are considered high? What's considered low blood pressure? And how do we accurately identify each of these? Risk factors impacting someone's blood pressure. Our recommendations for monitoring your blood pressure at home. And how to identify a blood pressure emergency and what to do in this scenario. How to measure your blood pressure at home. You'll need a blood pressure machine with an arm cuff, a log sheet, a pen or pencil, and a quiet place that you can use for about 10 minutes. Make sure you're relaxed. Sit in a chair with your feet flat and back straight and supported. Don't smoke, exercise, or drink caffeine or alcohol 30 minutes before taking your blood pressure. Rest quietly in a chair for about 5 minutes before starting your measurements with your measurement arm flat on a table with the palm up. Use a blood pressure machine with an appropriate cuff size and fit. Take 3 readings separated by at least 1 minute and record all results in your log sheet. Take your blood pressure at the same time each day, ideally early mornings or in the evenings. Go ahead and pause this video at this time to take your blood pressure now. Now that you've taken your blood pressure, write it down. We'll look at what it means throughout today's session. So now you know how to take your blood pressure, but what does it mean? What is blood pressure anyway? These numbers tell us how hard the blood is pushing against the walls of our blood vessels, also known as our arteries and veins. You probably noticed that there are 2 numbers when you measured your blood pressure, the top number and the bottom number. The top number is also known as the systolic blood pressure. This is how hard the blood is pushing during a heartbeat. The bottom number is called the diastolic blood pressure, and this is how hard the blood pushes between heartbeats. These numbers give us a good idea of how much stress or strain is on our blood vessels on a regular basis. So why is it important to have well-controlled blood pressure? Well, there are many ways that having uncontrolled blood pressure can pose health risks. It puts too much strain on your blood vessels, which makes your heart have to work harder. Can you think of some conditions that are associated with high blood pressure? High blood pressure over an extended time can lead to many health conditions or risks, including stroke, vision loss, heart attack or heart failure or other cardiac events, kidney disease, sexual dysfunction. These are just to name a few. What is considered normal blood pressure? Are you familiar with which numbers we'd ideally like to see on the top and on the bottom? In order to identify abnormal blood pressure, it's important to know what is considered normal blood pressure. Even though everyone is different, ideal blood pressure is considered to be around 120/80 or below. According to the American Heart Association, high blood pressure is considered to be anything over 130/80. This is the most recent recommendation, which may be different than what you had originally learned, as this has changed over recent years. Ask your doctor which blood pressure range is safe for you. This chart shows us what various levels of blood pressure mean. As you can see in green, normal blood pressure is less than 120 for the top number, the systolic blood pressure, and less than 80 for the bottom number, the diastolic blood pressure. Blood pressure is considered elevated when it is between 120 to 129 for systolic, as you can see in the yellow. When the top number is 130 or above and the bottom is 80 or above, we're now in the range considered high blood pressure, shown in orange into red. If your blood pressure is above 180 for the top number or above 120 for the bottom number at rest, this is considered an emergency or crisis. If you have no symptoms, you should retest after resting quietly for 5 minutes. If it is still higher than 180 on top or 120 on bottom, you need to call 911 and contact your provider immediately. At any blood pressure range, if you're experiencing symptoms such as chest pain, shortness of breath, numbness or weakness, change in vision, or difficulty speaking, call 911 right away. Doctors and primary care providers typically prescribe medication for patients whose blood pressure tends to stay over 140/90. However, this may be different for each patient. Consult your provider for recommendations for you. Now let's go back to your blood pressure reading from the start of the session. Which category does it fall into? What are some symptoms of high blood pressure? Actually, there are none. High blood pressure, also known as hypertension, is often called the silent killer, as it most often has no symptoms. Most people won't know that they have high blood pressure if they do not measure their blood pressure regularly. Healthcare professionals no longer provide a list of symptoms for recognizing high blood pressure, as there are none. We cannot reliably depend on symptoms to know whether or not we have high blood pressure. This is why measuring it with a machine regularly is so important. There are many factors that impact your risk to develop high blood pressure. The risk factors affecting blood pressure are typically broken into two categories. 1. Non-modifiable factors, things outside of your control. And 2. Modifiable factors, things that you can control to some extent. What do you think are some factors that may affect your blood pressure outside of your control? These include your age. The older you are, the more likely you are to get high blood pressure. Your family history. If your parents or other close blood relatives have high blood pressure, you are more likely to have it too. Gender. Under the age of 64, men are more likely to have high blood pressure. However, after age 65, women are more likely to get high blood pressure. Your race. African Americans are more likely to develop high blood pressure compared to other racial groups in the US. Chronic kidney disease. High blood pressure may occur as a result of kidney disease. How about things you can control? Can you think of factors you can control that may affect your blood pressure? These include physical activity or exercise. Physical activity is great for your heart and blood vessels in general. What you eat. Eating foods that are low in salt, calories, sugar, and fat content can lower your risk of high blood pressure. Your weight. Well-controlled body weight can reduce strain on your heart and blood vessels, which reduces risk of high blood pressure. Alcohol intake. Reducing or eliminating alcohol intake can reduce high blood pressure as well as many other health risks. Blood sugar, especially for people who also have diabetes. Well-controlled blood sugar reduces your risk for high blood pressure. Smoking or tobacco use. Quitting smoking can prevent damage to blood vessels, which reduces high blood pressure and other health risks. Stress levels. Stress is not always bad, but stress management techniques can lower your risk of high blood pressure. Often, lowering your stress can help with maintaining other healthy behaviors such as your diet and exercise. And sleep apnea. Getting quality sleep is important. If you think you may have obstructive sleep apnea or other sleep issues, this may increase your risk of developing high blood pressure, so consult with your medical provider. High blood pressure usually gets most of the attention as it tends to be more common and also more risky to our health over time. However, blood pressure falling too low is also possible. Have you ever experienced low blood pressure? What did that feel like? All of these can be symptoms of blood pressure that is too low. Dizziness or lightheadedness, nausea, fainting, dehydration or unusual thirst, lack of concentration, blurred vision, cold, clammy, pale skin, rapid, shallow breathing, fatigue, and depression. However, according to healthcare professionals, there is no specific number that is considered too low as long as you're not having symptoms. All of the following could cause low blood pressure, including prolonged bed rest, pregnancy, loss of blood, certain medications, check with your doctor about these, heart conditions, endocrine problems including hypothyroidism, parathyroid disease, Addison's disease, low blood sugar, and diabetes, severe infection, an allergic reaction, or nutritional deficiencies such as vitamins or iron. So what do you do if you feel these symptoms and you think your blood pressure may have dropped too low? Lay down and wait for symptoms to subside. Typically, one episode is not cause for concern. You can also measure your blood pressure to see what level it is. If symptoms do not subside in a few minutes, call 911. If it happens repeatedly, consult your healthcare provider and bring your blood pressure log with you. Okay, so now you know what blood pressure is. You know why it's important to keep it well controlled and what the risks are of uncontrolled blood pressure. You also know why we need to measure blood pressure regularly. You know that high blood pressure won't always have symptoms. You also know about low blood pressure, which symptoms to watch out for, and what to do when your blood pressure drops too low. But what do we do with all of our daily blood pressure measurements? What do you usually do with your blood pressure measurements? We recommend the following plan. Measure your blood pressure once or twice a day as recommended by your doctor. Try for the same time each day. Write it in a journal. You can show this to your doctor at your next appointment. We have included a blood pressure log with this session that you can use if you don't have one. Remember, one blood pressure measurement is a snapshot. Several measurements are a time lapse. Seeing how it trends over several days can give your provider helpful information about your average blood pressure ranges, whether your medication is working, and if any changes are needed to your medical plan or daily routine. Remember, if your blood pressure is higher than 180 over 120, without symptoms, wait 5 minutes and test again. If it is still high, contact your doctor immediately and call 911. With symptoms at any blood pressure, such as chest pain, shortness of breath, numbness and weakness, changes in vision, or difficulty speaking, call 911. These symptoms are emergencies, and you should seek emergency medical attention. Remember, if you have been prescribed medications to control your blood pressure, these will impact the measurements you take at home. How do you think your blood pressure measurements will compare before and after taking your medication? Tracking your blood pressure at home is the best way to know if your medications are working. When measuring your blood pressure at home, your doctor may ask that you measure your blood pressure both before and after taking your medications. Please ask your doctor for specific recommendations for how to time your blood pressure measurements. Please don't make any changes to your medication routine or stop taking any prescribed medications without consulting your doctor first. With exercise or other physical activity, it is normal and expected for blood pressure to go up. Discuss with your healthcare provider for specific guidelines. Remember, warm up and cool down are important. You want to perform at least 10 minutes of each. Regular exercise is a great way to lower your overall blood pressure and improve cardiovascular health. Remember, exercise is one of our modifiable risk factors. Listen to your body, stay at a level that works for you, and take breaks when you need them. There are many other rich workshops, including physical activity recommendations, healthy living workshop, and improve the way you move workshops, as well as goal setting workshops. Check these out for more information about exercise. This scale is a great way to assess if your physical activity is challenging enough for you. We don't want to do exercises that are too easy in the blue range or too hard in the red range. We want to stay in the green or yellow zone where an exercise is hard or somewhat hard. Does your blood pressure change throughout the day? What daily routines and activities may affect your blood pressure? Blood pressure can change throughout the day depending on your body's rhythms, if you've just eaten a meal, what time you take your medications, if you're stressed, if you've just exercised, if you drink caffeine, so on and so forth. Please visit the Rancho Virtual Wellness main page for more resources to improve your wellness and reduce risk for high blood pressure, including the exercise media library, guided meditations, support groups, and more. How do you know if your blood pressure medication is working? It's important to keep a blood pressure log. Take blood pressure measurements at the same time every day. Important to track numbers over time. One blood pressure measurement is a snapshot. Several measurements are a time lapse, which paints a more accurate picture of your blood pressure levels. Discuss with your doctor if you feel your blood pressure is not well controlled. Many people experience something called white coat syndrome, meaning their blood pressure goes up when they visit their doctor or other medical appointments. Yes, this can happen, but it should still be taken seriously. It is often an early sign of hypertension or high blood pressure, which can be associated with stroke, heart attack, heart disease, or other health conditions. Methods to reduce white coat syndrome include: ask for a minute or two to relax at your appointment. Ask to move to a quiet part of the office. Deep breathing or other stress relief techniques, or try to distract yourself and focus on something else. There are no reliable phone apps for measuring your blood pressure. These should not be used in place for a blood pressure machine. However, there are some great apps that you can use to log and track your blood pressure. Above are a few examples. Thank you for your participation in the blood pressure learning workshop today. Please feel free to watch this as many times as you'd like. Please return to the main Rich page to print resources including a blank blood pressure log and blood pressure ranges. Also, please check out the other Rich workshops for other topics including healthy living, goal setting, exercise, arthritis education, and more.